Kidney. Let us study about the kidney now. Guys, in kidney, we already know the extent of the kidney. Kidney will be extending from T12 to L3. We know that. And we also know that both the kidneys are not at the same level. Even though it's from like T12 to L3, but both the kidneys are not at the same level. Right kidney is a bit lower when compared to the left one. And there is obvious reason for that one. The right kidney is lower because of the presence of the liver there, guys. Fine. But that is not like important thing to be studied about the kidney for your PGME exams. The only and the most important thing about the kidney to be studied for your PGME exams is the relations. Even in the recent exam, they have asked a question where they have given an image of the kidney and asked about the anterior relation of that one. So relations are very much important, guys. Now first, let me just give you the orientation here. Now when you are going to learn about the relations of the kidney, we have to learn the relations of anterior surface of the kidney and posterior surface of the kidney. But try to understand, we have got like right kidney and left kidney. Both the kidneys are present on the posterior abdominal wall. Right kidney and left kidney, both of them are present on the posterior abdominal wall. And posterior abdominal wall is absolutely the same on both the sides. Yes, the posterior abdominal wall is the same on this side as well as on the other side also. So because it is the same on both the sides, that's the reason why for both the kidneys, right kidney as well as left kidney, posterior surface relations will be same only. We don't have to learn it separately. So posterior surface relations will be same only for both the right kidney as well as the left kidney. But whereas the anterior surface relations of the right and left kidney will be different. In front of the right kidney, you'll be actually having your liver and all those things. And in front of the left kidney, you'll be able to appreciate the stomach, pancreas, spleen and all. So we need to learn the anterior surface relations of both the kidneys separately guys. That's the planning. And keep this planning in your mind, and let's get started now with the posterior surface relations of the kidney first, guys. Let us learn about the posterior surface relations. Now, as I told you, we don't have to learn the posterior surface relations separately for both the kidneys. That is the reason why let us just draw only the diagram of only one kidney. And imagine this is your left kidney we are seeing from behind. So it's not the anterior view, guys. We are not seeing from the front here. Always we have a habit of looking at the diagram of the kidney from the front only. But remember, this is not from the front. We are actually looking at the kidney from behind. So that's your left kidney. And we are looking at this left kidney from behind. Perfect. Posterior view of that. Now, what are the structures which are related to this one here? You just have to draw one horizontal line here like this. And then the two vertical lines here like this. Now what is this? The upper part on the posterior surface, the upper part will be actually related to diaphragm. And again the same question comes in our mind. How come diaphragm is going like behind the kidney? Again the same answer. What is the shape of the diaphragm? It is actually dome shaped. So suppose if this is my kidney here, okay, left kidney, you just imagine this one to the kidney, the dome shaped diaphragm will be going behind and it is related to the upper part of that. And the lower part will be actually related to the muscles which are going to form the posterior abdominal wall. So the posterior abdominal wall is actually formed by, on the medial side, you'll be actually having psoas major muscle. Medial side will be actually having the psoas major muscle. Just lateral to that, you'll be able to appreciate quadratus lumborum muscle. Quadratus lumborum muscle. And lateral to that, you will be able to appreciate the transversus abdominis muscle. Transversus abdominis muscle. So there will be psoas major on the medial side, then you'll be actually having quadratus lumborum, and then followed by lateral to that, there will be transversus abdominis muscle, guys. So the three muscles of the posterior abdominal wall, we have even drawn this diagram when we studied about the posterior abdominal wall as well as the thoracolumbar fascia also, guys. Now apart from that, you'll be able to appreciate like the two nerves which are coming out between the psoas major muscle as well as the quadratus lumborum muscle. So between the psoas major and quadratus lumborum, these two nerves will be the iliohypogastric nerve and another one will be the ilioinguinal nerve. Now these two nerves are actually the branches from lumbar plexus, and that too they are originating from L1. And I told you just now, try to recall in your mind, the kidneys are actually present from T12 to L3 only. So somewhere in the middle there is L1, T12, L1, L2, L3, L1, and right from there, yes, we can clearly appreciate the lumbar plexus, and those two are the branches of the lumbar plexus coming from L1. Iliohypogastric nerve and iliogonal nerve. Now the last and final thing, one more thing if you want to remember here. Yes, below that arcuate ligaments, as I told you, there will be subcostal artery, there will be subcostal vein, and then there will be subcostal nerve there, guys. So this that I have drawn here will be the subcostal artery, vein, and the nerve. Perfect. And that is the reason why we don't have to actually draw it separately for the right kidney. It's absolutely like copy paste. Okay, in the left kidney and the right kidney, the posterior surface relations are absolutely same in both the kidneys. So no need to learn it separately. But do you still have any difference? Not even a single? Yes, there is one difference here. If suppose this is the left kidney over here, then it will be actually related to the rib number 11 and as well as the rib number 12 here. Be careful, I'm telling you about the ribs right now, sir. So this is the 11th rib here as well as this one is the 12th rib here. So the left kidney is related to both the ribs. And try to learn conceptually here, guys. Right kidney is not exactly at the same level. A right kidney is a little bit below. So remember, right kidney is related only and only to the 12th rib. Not both the ribs, it is only related to which one, sir? 12th rib. Because the right kidney is a little bit below. So I would request you to write it somewhere. All the relations are absolutely same for the right and left kidney posteriorly, except for the right kidney is related only to the 12th rib, whereas left kidney is related both to the 11th as well as the 12th rib, sir. So left kidney is related to both 11th as well as the 12th rib, whereas right kidney is related only and only to the 12th rib. That's all. That's about the posterior surface relations. Now when it comes to anterior surface relations of both the kidneys, it is totally different, separate. So we need to learn for both of them. But the problem here is that there are so many structures related and it's difficult to just memorize the list. Okay, right kidney is related to so many organs in front of that, left kidney is related to so many organs in front of that. It's difficult to memorize that entire list. So I'll tell you one simple trick here how to remember about the anterior surface relations. Follow my trick here, guys. Okay. So first of all, let us write down here as anterior surface relations. Perfect. And then what you do is you just draw a general diagram here along with me. A general diagram here. Esophagus and this one here. The greater curvature of the stomach. And the lesser curvature of the stomach over here. And duodenum first part, second part, third part and the fourth part of duodenum. The same old diagram that we have been drawing from the very beginning of the abdomen topic. Now imagine this one to be your pancreas over here. And then somewhere behind here you'll be actually having a spleen. We all know the tail of the pancreas will be lying in the hilum of the spleen there. Now after drawing this diagram, just try to introduce the kidneys in this diagram. And where do you have the kidneys? It should be present behind all the structures. They are retroperitoneal. So imagine here this one to be your right kidney. Perfect. And this one here will be actually the left kidney, guys. Now once you draw this diagram, believe me, all the anterior surface relations of both the kidneys will become damn easy. So now let's actually draw the diagram of the right kidney here. Now this time it is not the posterior, it is actually the anterior surface of right kidney. And imagine this one here to be your left kidney here, guys. Perfect. Now this one is the anterior surface relations we are going to see for the right kidney as well as left kidney now. Now one thing, upper part of the right kidney or the upper part of the left kidney, both of them are actually related to suprarenal gland. That is suprarenal gland. And that was a question which was recently tested in your exam. There was a cadaveric image of the kidney given. It was not even the textbook image or line diagram. There was a cadaveric image of the kidney given, and at the upper pole of that one, it was marked and it is related to which structure? So it is related to suprarenal gland. Both the kidneys, whether it is right or left, no change in that, because above the kidney there will be suprarenal gland. Now try to understand one thing here. The duodenum will actually continue into jejunum, so there will be like coils of jejunum lying over here there. So it means appreciate there, observe there carefully, both the kidneys, whether it is right or left, both the kidneys are related to your jejunum there, lower part. Now that jejunum will actually continue to ileum, ileum will go in and into cecum, Cecum will now continue above into ascending, and then there will be transverse, and then there will be descending colon. Oh, that means the lower end or the lower part of both the kidneys is even related to the colon also. So therefore, my dear friends, the lower part of both the kidneys is related to your jejunum. There will be jejunal area as well as the colic area. And yes, there will be a jejunal area as well as the colic area. So whatever we have drawn till here is absolutely the same for both the kidneys, whether it is right kidney or left kidney. So upper part is related to suprarenal gland in both the kidneys. Lower part will be related to the colon and jejunum, jejunal area and the colic area. Now once you are comfortable with this one, then what is the difference? Then what is the difference here, sir? Observe very carefully first of all towards the right side, right kidney. Passing right in the front of the right kidney, in the front of the right kidney will be your duodenum, second part of the duodenum. Okay, so therefore this area will be the duodenal area. It is related to second part of duodenum. And whatever part is left out, that will be actually related to your liver. So I'm just writing H here, that is hepatic area. Everything there on the right side will be just covered by the liver there, that is the hepatic area. So duodenal area and hepatic area, done. That's all about the right kidney. And then when it comes to the left kidney, in left kidney you can appreciate first of all there is a spleen here. So this part will be actually related to the spleen, splenic area. And what is going all the way up to the spleen, guys? Pancreas. We have been learning from beginning of the abdomen topic. So therefore definitely there should be a pancreatic area. And whatever little bit area is left out, that will be related to the stomach. So therefore this will be the gastric area. So the left kidney will be related to the spleen, and then there will be pancreatic area, the pancreas, and then there will be gastric area. There will be stomach related to that one. I think this is the best way to remember the anterior surface relations of the spleen. Instead of just mugging like a list, I have seen the students, right kidney related to suprarenal gland, the duodenum, liver. That is not the right way. Best way, practice this diagram, it will be easier for you. And apart from this, we don't have to worry about the blood supply of the kidney. Kidney will be supplied by the renal artery and drained by the renal vein, guys. Perfectly done. So that completes about the kidney topic.